Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
And good morning, it's Darren Allred filling in for Dee Blanton on the Community Service Report. This is a Thursday, May 11th, and we are happy to be joined by the Chief Executive Officer of Muenster Memorial Hospital, Brian Roland. Brian, how you doing this morning?
Hey, doing great, Darren. Really glad to be here. Glad to get a chance to talk to you this morning.
Yeah, sorry I'm not Dee. I know you're used to Dee, but I'm looking forward to finding out all of the great things going on over at Muenster Memorial Hospital. Y'all do some great work over there. And just, I guess, get us started. It's hospital week, right?
It definitely is. And I do want to start off, I do wish Dee a speedy recovery. I really enjoy working with you, but, I'm sure Dee wants to get back here, and I know he really likes working with me, so we work well together.
Trust me, we all want Dee to get back. I've told this many times, I'm not a morning person, and this waking up at 4:30 in the morning is about to kill me. But, yeah, speedy recovery for Dee. I think he's doing a lot better, and hopefully he will be back with us soon. So, yeah, there you go, Dee. There's your shout-out on the Community Service Report this morning.
There you go. But, yeah, Hospital Week, we're right in the middle of it. And what a lot of people don't understand is Hospital Week really started many, many years ago. It started back in 1921, and it was more as a tribute to Florence Nightingale, who really was the pioneer to get nursing, that profession, to become a reputable job and to get people really involved. And so it was kind of a tribute to her, and it kind of always hit around her birthday, which is the 12th of May. 1953, it really kind of kicked off as a week-long festivity to not just talk about the nurses and the wonderful job they do in all of our facilities. We could not have the facilities that we have without the wonderful nurses, but to also look at what all of the employees do and talk about the benefits we get from all of them, and to have activities to basically show that we appreciate them on an ongoing basis. And so in our case, we've had stuff going on all week. We've had the volunteers bringing in snacks. We're going to have Taco Thursday today. Yes, and it's actually Thaco Thursday, so it actually matches. And then we end it tomorrow with the cook-off at the hospital, 5:30, and behind the facility. We use that now, so we kind of have the lake and bring all the family members of all of our employees out. We have gifts, and we have a little party, and just to show our staff that, you know what, we really, really do appreciate them. And really, in my role as a CEO, no matter how good your CEO is in your facility, they can't do the job without all of the people around them. And this really gives us the chance to show them and that we appreciate them, and we can't do the job without them.
Yeah, great employees and great volunteers. You couldn't do it without both of those groups, I'm sure.
Definitely. And what that really then ties into for us is, okay, this is a great snapshot of what goes on at our hospital. Well, then we have been working on our community needs assessment for healthcare. And the interesting thing for us is the final report. We have the draft now. The actual final report will be coming out here probably in a couple weeks. And the interesting thing about the community needs assessment, which we've really never done one before in Muenster, is it's not just what can the hospital do for the community, it's what can the community do as a whole with the hospital and bring us all together and create an even stronger healthcare environment and continue to help Muenster grow the right services at the right speeds and kind of help us with our strategic planning. We as administrators think we know what's best for our hospital, but when you get the community involved, and where we had 40 people come in from the outside and say, hey, I think you need this, or we should look at that. We've also asked our employees, what are your thoughts in our community? Your community people too. And what can we build from that and over the next 5 years? Because again, if we're following our mantra, we've got to manage today as we prepare for tomorrow. This is one of the steps that we do, and it actually gives us a roadmap to try to follow.
Yeah, and it's got to be a very important thing to for y'all being a rural community-based hospital to find out what the people in your community need and expect from your hospital.
Well, and the interesting thing with that is you throw in the rural thing. Not only are you looking at the community needs, you're looking at how can we make this all happen? Can we meet all of those needs? Right now, it's an interesting thing with the legislative stuff going on right now. You love a government who basically mandates things that you have to do and then ties one hand behind your back as you're trying to make it happen. And so right now, we're in the last couple of weeks of the legislative session in Texas. We just had the, I guess we can call it the repeal and replace, sort of, passed, because I think there's still things in the old Obamacare or the Affordable Care Act that will become part of the new program, and trying to figure out how that's going to affect us and our hospital and our people. And then as that's all playing through, what is the state of Texas doing to us? Right now, this year, there were 250 bills that went through and were talked about that affected not just healthcare, but rural healthcare. And it was crazy things from, hey, can I file a lien against you because you owe me money, to cutting the limits on what I can raise taxes, to how I get paid by Medicaid 3 years from now. And so it's a very interesting balancing act as you try to keep up today and not run into the pitfalls of what we're dealing with today, as you see with some of the other hospitals around us, but also trying to have the foresight to say, okay, 3, 4, 5 years from now, what do we need to have in place to be prepared? And yes, you'd love to have that crystal ball, but it's more like a magic 8-ball that we're using right now.
Well, I was going to say, at least you have a state representative from your local area. I'm guessing you've got Drew Springer's on speed dial. Ask some questions and give some advice, maybe.
Speed dial. Anytime he's in the area, I try to talk with him. It's interesting when you're the CEO of the hospital. A lot of time, legislative folks, that's the last people they talk to. And so a lot of times it's us going out with them, but we are very lucky with Drew because he does talk to you. He's been to my office. We've chatted at the forums. We've met at other meetings. And he does have an ear for us in rural healthcare, because not only does he have Muenster in Cook County, but he has a lot of rural areas and a lot of rural hospitals. And one thing that changes could affect a lot of the people in his areas.
Well, like I said, you never know what's going to happen with the legislature. It probably changes every day, and I can only imagine you as the CEO having to keep track of everything. I don't know how you get your updates or how you read through all the bills and things. It'll be interesting to see what happens, though, with this latest round, as now at the federal level, that repeal and replace mandate goes from the House to the Senate, and what the Senate decides to do there and how that affects hospitals like Muenster Memorial Hospital. All right, as we wrap things up, I know you've got some well wishes to give out today.
I do. We've got Mother's Day coming up here in a couple of days, and I do want to take the moment to say Happy Mother's Day to all the mothers out there, but especially my mom, Marianne Roland, who is 81 years old. Let me rethink that. She's 80 years old. I better make sure I'm right on that one. Few health issues, but I do want to tell her that and this is a quote from Abraham Lincoln: all that I am or hope to be, I owe to my angel mother. And that is really spot on with my mom. So I wish her the best and all of the mothers out there.
All right. Well, we second that sentiment for all the mothers. The important job that they do and continue to do in shaping all of us here in our community of Cook County. Brian Roland, the CEO of Muenster Memorial Hospital, thanks so much for joining us today. You've been listening to the Community Service Report from Hometown Radio, 1580 KGAF.